What's up, guys? It's Dr. Jim. I am your CBD expert, your natural health care expert, and your worldwide virtual health coach. And I want to welcome you to tonight's live. Thanks for getting on. When you're getting on, if you would just please go ahead and put in where you're coming in from. I always love to know because people are coming in from all around the world all the time. Hold on. I can't see comments. Where are the comments? No comments yet? Can somebody, hold on. There we go. I can see something now. All right, so when you're getting in, thank you for getting on. Go ahead and put in where you're coming in from because I like to know, this is going all around everywhere. But tonight is going to be a completely different style than anything I've done up until now. Hi, Nicole. Thank you, Jim and Tammy, for getting on tonight. I have a terrible time trying to read comments and give really awesome informational talks. And so what I tried to do tonight, hey Mom, thanks for getting on. What I usually try to do is give you a whole bunch of value in a video and really just give you a lot of really good information. And I had a super busy day today. We had, like 4 new pregnant chiropractic patients. I saw a ton of people, and I just didn't have enough time to completely get together a fully researched, super educational video for everybody. So I wanted to try a slightly different topic tonight. And the way I wanted to structure tonight is CBD oil Q&A. All right, so what I want everybody to do is think of a couple questions you might have, whether it be you or someone that you know wants to take CBD oil or whatever it is, and I'm going to do my very best to try to read from the comments and answer those questions for you. But while we're doing that, number one, I want you to put in where you're coming in from, and second, I want to know, are you watching this live? Because are you getting the full energy of Dr. Jim live? Are you watching it on the replay? Either way, it's going to be awesome. It's a Q&A. If you are watching the replay, please post your questions in the comments, and I will do my very best to answer them, the same as I'm going to try to do live tonight. So thanks for getting on, everybody. I'm excited. We're going to have a lot of views. This is going to be a big night. So please put in where you're coming in from and whether you're watching it live or on the replay. Now, what we're going to do is go ahead and start dropping some of your questions. What are some things you would like to know about? Now, I am also, while you're doing that, I'm going to give the disclaimer because invariably people are going to want to ask me about specific conditions. Now, here's the disclaimer, all right? Number one, I'm not your doctor tonight. You are not my patient tonight. There is nothing about this video that constitutes a doctor-patient relationship. So please do not change anything about your medical care because you heard me talk about something cool on a video. Second, CBD oil is a natural supplement. It is not a drug, all right? So it is not a drug. Therefore, it is not designed to diagnose, treat, or cure any specific disease. However, the research does show that there are really awesome there's really awesome things out there that it can help with. It helps in a lot of different ways. And so I'm going to go over those things tonight. So the first question I see is, does CBD have a specific color? That's a great question. I don't actually know. I do know that it's like, at least the CBD oil that I recommend is a fairly nice clear with sometimes a slightly greenish tint, and the greenish tint comes from the base or the hemp seed oil. So a lot of times the CBD that you take is going to be what the color you're going to see is going to be from the carrier oil. So if it's in coconut oil, it's going to be colored. It's going to be whitish compared to a clearer oil like hemp seed oil. So it just depends what the carrier oil usually. Is CBD safe for toddlers, children, and kids? Generally, yes. That would be, obviously all parents have to make that decision whether they they think it's okay to give to their kids or not. I would tell you I have given it to my son. I have absolutely no concerns about it, just like I have no concerns about giving vitamin C to my son. And that is simply because CBD oil has been proven to be very non-toxic, non-addictive, and it's anti-inflammatory, and it helps balance the endocannabinoid system, which is something you would certainly want for your toddlers or your children or your kids. Now, obviously, what you do have to realize is that, certainly you have, with them, just like everybody else, I would start low and increase very slowly with them. So that's kind of my answer. So yes, I do think that CBD is safe for toddlers and children and kids. I mean, the only drug approved, well, here we go. Will CBD oil help COPD? That's a great question. So COPD, chronic obstructive pulmonary disease, has some connections that are similar to asthma. They kind of work in similar ways, even though typically COPD can be caused by irritations or things that you had before. Now, so therefore, if you're looking at it from the standpoint that there's an inflammatory asthma-like event happening in the lungs, it could have a positive impact on bringing down some of that inflammation. So it may have a positive impact. I'm not aware of any exact studies, however, so I want to be careful saying that. I'm going to go back because I saw another question. I hope that helped you with that one. How does CBD help a pinched nerve? Well, to be honest with you, CBD doesn't really fix a pinched nerve, right? I mean, I'm a chiropractor. A pinched nerve is when things get out of alignment and they put physical pressure on a nerve. CBD oil does not fix physical pressure on a nerve. However, what does a pinched nerve, what's going on when there's a pinched nerve? Well, there's inflammation and there's pain. Now that's where CBD oil comes in, because CBD oil has been known to affect CB1 and CB2 receptors to either directly or indirectly, which is how it really affects CB1 receptors. But by doing that, it can have an impact on how you perceive pain, and the CB2 receptors that are all over your immune system. CBD helps reduce inflammation. So around a pinched nerve, there's always going to be inflammation and pain, and that's how CBD oil can have a positive impact in a pinched nerve. Of course, I'm going to recommend that you also go see your chiropractor. That's what I would do. All right? Now, can it be used to treat acne? Well, here's the thing. Acne is, so this is what I want you to understand about acne. Acne is an internal problem expressing itself on the outside. All right? I mean, think about that. That basically your skin is the largest detox organ in your body. So if you're having acne and adult acne and these kind of things, what it tells me is that your internal environment is not balanced and it's toxic. And so what we know is that CBD oil helps. It helps in the gut. It helps reduce microbes in the gut, and it helps tighten the tight junctions so that we have less leaky gut problems, which are all known to be the internal environment trying to detox itself out through your skin. Second, along with acne, there's a lot of inflammation and irritation that goes along with it. So some of that is actually almost it's an immune response. Literally, the cystic stuff is actually an immune response in the skin. When things get clogged up, your immune system goes in and starts attacking. And so helping calm down the immune response. Also, CBD and things from the hemp plant they're very antiseptic. They help, a lot of things don't grow on it. And so it can have some antibacterial effects to it as well. So yes, I think CBD oil is great to help with acne because it's anti-inflammatory. It helps heal and do some positive things in the gut. And if you put it on topically, it has some antimicrobial effects as well, which is really cool. All right. Now, it'll get a little tougher here, because what amount of milligrams would help collagenous colitis? Well, here's the deal. Anybody who, and we can end dosage questions with this one. the first and the last one we need to answer during this. Like I've said in previous videos, when it comes to dosing CBD oil, the exact dose for your condition is exactly whatever it's right for you. Okay? So I know everybody wants to know, well, do I need to take 30 milligrams of CBD for my migraines? And do I need 20 for my colitis? There is no exact amount. What I want you to understand is that CBD oil is the effects and how much you should be taking are 100% individualized to every single person. All right? So, no matter what you have, if you have a problem, you should start taking CBD oil low, like 3 to 5 drops. If you have 500, 750, start 3 to 5 drops. And then you slowly increase it every couple days until you start to notice a positive impact. Or you notice that the other side, which is oh God, I don't think I felt very good for it. Well, then you're too high, or you went up too quickly and you back down a little bit and hang out for a minute, okay? But that's how we figure out how much you should be taking. So it's not the condition, it's the person, all right? No matter what, you always treat the person. No matter what, always treat the person. The condition is just something that you're dealing with. We need to treat you, okay? Do you have to take it every day to be effective? Thank you, Bill. So my recommendation, I mean, some people treat it like a drug. And if you treat it like a drug and you say, well, geez, I can't sleep tonight, and then you take some CBD oil and you feel like you fall right asleep, and then you don't take it again until 4 days later, you can't sleep again, you take it again and you fall asleep, it can be effective that way. However, that's not how I would recommend using CBD oil. And the reason is because you're working on balancing a system. And just drop, like, here's an idea. If you wanted to eat healthier because you wanted to lose weight, would eating a salad one day at lunch 1 week and then not doing it again for another week, would that be an effective way to use a salad in your weight loss attempts? And so might you lose weight by tomorrow? Yes. But are you getting the best benefits that you can? So in order to get the best benefits from CBD oil, I would recommend taking it every day because there's antioxidant effects. I mean, you want those every day. It helps balance the immune system and helps all your systems talk to each other. I want that every day. It helps protect the brain. It helps reduce inflammation. These are all great things to have going on every day. So I recommend taking it every day. All right, so I just got a question about how many days would one need to stop use of the full spectrum if concerned about drug testing? I don't know. The truth is probably the best thing to do is you stop it and then you kind of do a little bit of you can do like an iced tea detox and just start drinking, drink a whole bunch of tea for a couple days. Whoa, what just happened? I don't know. Hold on. There we go. You could drink tea for a couple days and maybe that, I'm sorry, I'm just messing with my phone here. And maybe that would really help. So, but I don't know. If you search on the internet, the best places to find that information are from the pot smoking websites because they know every trick in the book about how to speed up so that once you stop, once they quit smoking, how long before they can pass a drug test. I unfortunately don't know that because I don't come from that background, okay? All right, so I got a question from Jennifer on CBD oil and PCOS. Well, here's some really good information about that. Number one, PCOS at its core often is connected to insulin resistance, okay? So women that typically have PCOS have already begun to experience PCOS. Women with PCOS have already begun to experience insulin resistance, and that insulin resistance problem drives like higher testosterone, and it creates this whole endocrine hormonal imbalance problem, and that's what drives it. So number one, we've talked about in previous videos that CBD oil has a really positive impact on insulin sensitivity and blood sugar levels. So it can be really probably very beneficial for that. Also, CBD oil, because it helps balance, it connects to the endocannabinoid system, which helps control all of your organ systems. Having a positive impact in the talk across all of those may be beneficial as well for PCOS. Now, is it an exact cure and treatment for PCOS? Once again, we're not here to diagnose or treat or cure any specific conditions. Could it be beneficial? Absolutely. If you are absolutely it can be beneficial. I just don't want anybody to be like, oh, I'm just going to take CBD oil and I'm going to fix everything I've got. You know what? I just don't think that's the best way to look at CBD oil. It's kind of like, all of the, there's lots of, now, do I think it's maybe one of the very, very best places to start? Absolutely. Because it has its hands in so many areas of your body, and very, very few substances do. But I just don't want people to use it like, you know what? I'm going to keep eating, a pound of sugar a day and drinking all the soft drinks I want, and I'm going to take this CBD oil and it's going to help with all of my problems, right? So it can be beneficial for those kinds of things. There's a lot of other things with diet and other supplements that can be really helpful as well, but that's a great question. I hope that helped. I got this question the other day. What about Steven Johnson syndrome? I had to look it up even when I got the question, and I don't know. Sorry, Carla, but that's a great question. Maybe if you get some information, you could message me. I'd love to hear more. Can CBD oil help with cold and flu symptoms? That's a great question. I haven't read a lot about it. Basically what I can do is take the information the way I understand it and kind of let you know. I will tell you that a lot of symptoms you experience when you have a cold or the flu are basically inflammatory symptoms in your body responding to the viral agent. So it's like you raise your temperature because your body's trying to kill it. You have this inflammatory response. So all your inflamed sinuses and snotty noses and all of those things are really an inflammatory immune response trying to get rid of whatever it is. So CBD oil may possibly calm that down, okay? But at the same time, I'm here to tell you that most of the symptoms you experience during the cold and the flu, that is your body trying very hard to get rid of it. So if I have a fever, I don't want to bring it down when I have the flu. Because you know what? That flu virus is supposed to grow at 98 to 99 degrees. But when I go to 101, guess what? My body temperature is killing that virus. So once again, it's the reason why I don't want us to use CBD oil like a drug, because your body has an innate intelligence in it that knows what it's doing, all right? But it can help with the symptoms. I think that's a great question. Dr. Jim, can CBD oil help a golden retriever? Thank you, Johnny. Can CBD oil help a golden retriever that has been diagnosed with blasto, a fungal infection? That's a great question. I'm not 100% sure, but I will tell you that, like I said before, is that CBD oil is antimicrobial. There's a reason why they don't have to spray it with pesticides and stuff like that, because typically a lot of those things, funguses and, molds and things, don't really like to grow on it because it's a weed. That's why its cousin is called weed. All right. So I'm not 100% sure. I certainly would say it could be beneficial. Certainly you'd want to do any of the other things that you would be doing for that kind of problem. Dawn, can it help with weight loss? Well, yeah, that's a great question, Dawn. And the answer is yes, it certainly can help with weight loss. But here's the deal. You must change what you're eating with it, okay? Because if you think that you can continue on a eating style that wasn't good, and you don't lose any weight doing that, and then if you're gonna take magic CBD oil that's all of a sudden gonna make you lose weight, then that's just not gonna happen. However, if you have a program, because I happen to have one, all right? If you have a program that says, eat this, don't eat this, eat during this amount of time, don't eat during this amount of time, and you added CBD oil into it, yeah, CBD oil can have a really positive impact on weight loss, because many of the things that keep weight loss from being easy are inflammation, blood sugar, insulin resistance, and CBD oil has a positive impact in all of those. So yes, I think it can be beneficial. Hey Mark, hello from Virginia. All right, let's see. CBD oil and Bell's palsy. I don't know. I'm sorry. That one I don't know about. I mean, I know what Bell's palsy is, and I know, how it happens, but I don't know. I would assume it could be beneficial, because a lot of times with Bell's palsy, it's almost like you get the paralysis in the facial nerve and you get the droop. And a lot of times the recovery is based on things like inflammation and how quickly all that goes away. So I would assume in the recovery it may be very beneficial. It's not going to necessarily cure it, but it may really shorten the amount of recovery time, which could be cool. I know CBD oil can improve neuropathy symptoms, but can it completely disappear? This is what I want you to understand about neuropathy. Neuropathy is nerves that are dying, and they're dying because they're not getting blood flow. And they're not getting blood flow usually because of something, whether it was a previous chemical insult. So some people that take chemotherapy end up with neuropathies because the blood vessels died. And CBD oil isn't necessarily going to increase the blood flow to those nerves. But the reason why it helps with neuropathy is because it helps reduce pain and inflammation. But I don't know that it's necessarily fixing neuropathy, I guess is the way to say it. So yes, I think it can definitely improve the symptoms of neuropathy, but to say that they completely disappear, I don't know that that's going to happen, but maybe it will. It's all about what other things you kind of do with it. Susan, hey, thanks for getting on. So do they get benefit from taking the THC free if testing is a concern? Yes. And the truth is, I like full spectrum, and it's just simply because I think that if you can get everything working together, in theory, I think it's going to have the best impact. It's kind of like I like vitamin C, not just as ascorbic acid by itself, but as a complement with all the other things that tend to exist with it in nature. However, if you go in many of the testimonial groups, many of them talk about people that switched to THC free, or just did that right outright, and they're getting amazing results. So CBD is, and most of the time when you're looking at a lot of the studies are done on CBD isolate, because they like to eliminate as many sort of variables as possible. So a lot of times they will go straight for CBD isolate for the research. And if the research is saying it's working, then it's going to work in people too. Thank you, Susan. Great question. Can you get diarrhea when you first start CBD? Linda or Linz, yes, you could. Well, of course you could. Why wouldn't you, right? Well, here's some of the reasons why. Number one is we already said that CBD oil can have an impact on microbes in your gut, okay? It can actually work on killing the bad dudes, all right? Well, it's very much like if you take a probiotic, which helps put good stuff in and it helps kill the bad, whether it be yeast or fungus or other pathogenic bacteria. Well, if you put CBD oil in there and you got a really, gut full of this stuff, well, there's going to be die-off of the bad stuff, and that will often cause diarrhea. All right? So I hope that answers your question. That's one of the reasons why we like to try to start low and slow and kind of increase so that you have less of this really horrible, awful, we want the least amount of side effects when you start it. So Manuela, is it possible CBD can cause issues in the stomach? I hope I just answered that. Bell's palsy, I just answered that. When I had my cold, CBD oil made no difference. I continued taking my cold, just ran its course. Well, yeah, Rhonda, that's very fair. Like I said, it's, the cold is going to do its thing, and really you want it to run its course, okay? The truth is CBD oil doesn't necessarily make anything happen that's not supposed to happen. Really, it's about helping your body balance, and if it's supposed to be fighting and have all those symptoms, that's what it's going to have, and so I think it's okay. Yes, CBD oil and weight loss. What is your weight loss program? Do you mind sharing? I'm from, Brandy. So yes, I'll talk about it real quick. I created the world's first online health transformation program featuring CBD oil. What that means is I combine taking CBD oil, which we've talked about a ton of the positive benefits, the reduction in inflammation, helping balancing and creating homeostasis in the body, reducing pain, helps lower blood pressure, does all this stuff. I married that with an eating style. And the eating style is very, very specific. It's designed to help reduce your fat storing hormones and increase your fat burning hormones. And so we eat very specific foods, and we eat in very specific timing to maximize your natural hormonal rhythms to put you into fat burning the most of the time, so that you can get the most fat burning you can get and lose the most weight as fast as you can. What's really cool about the program is because the reason why a lot of people don't get started in weight loss is they're just afraid they can't commit. They can't do it. So I made it a choose your own adventure program. So basically it's sort of like, here's what you can eat. And now you can eat it in this fashion, and you can choose to do that 2 days a week, 4 days a week, or all 7 days of the week. And I give you the how to do that in there. So it really makes it awesome. So you get CBD oil, an eating style, what to eat, how to eat, when to eat it, all that kind of cool stuff. There's a food list. There's a link to recipes, as well as then the final part of that is based on your health conditions. Let's say you had diabetes, all right, or you had a low thyroid. There's a section in there about supplements, and there's a link to go to a place where I have sort of condensed all my years of practice, and I said, okay, if you have this condition, these are the 3 other supplements I would recommend. Go order them and put them in the regime with your CBD oil, eating like this, and taking that. When people follow it at the most kind of intense level they can, at the sort of I want the most weight loss as quickly as possible, it is not uncommon to lose, you can lose up to, you can lose 20 to 30 pounds in 40 days. Now that's if you're really aggressive, but you don't have to. Some people are just looking, but this is what's key about that weight loss. It is about fat loss. It's not about weight loss. We want you to get more hydrated, speed up your metabolism, do all that kind of stuff. I hope that answered your question, Brandy. If you are interested in that program, click yes in the comments. And if you put yes in the comments, it will, in your messenger, it'll shoot you a link for an opt-in. You opt in and you can go watch a video about me explaining the program, everything, and it'll give pricing and you can check it all out, all right? So if you are interested in the weight loss health transformation program that I offer, put yes in the comments and we'll get that to you, okay? Can CBD help with benzo withdrawal? Well, I'm going to tell you, I mean, that's a big topic. There's a lot of people out there that if you look in the research, they really believe that because of the impact that CBD oil has on some of our neurotransmitters, things like serotonin, in helping improve serotonin and GABA, and also the impact it has on your CB1 receptors indirectly by increasing your anandamide, that it can be a really positive, it can be used very positively for helping reduce some of those issues. Now, it's not like you're still going to have some withdrawals. I mean, that's just kind of how it is. But it can really help with it, okay? Can it help with acid reflux? I don't know. That's a great question, though. I I'm trying to think of how it would, and I don't know how it would right now. All right, I've had one person tell me it did. That was somebody underneath there. It helps with mine. I was in 3 different meds for it now, not on any. Great. Tagged you to your favorite doc. Thank you. Help leg cramps. Dawn, great question. So a lot of people ask about leg cramps, almost more like sort of restless leg syndrome. It can be really, really good for that. Now leg cramps might be a little bit different. All right, we got a little while longer, and I'll do my best to answer after hours here, but we only got to go so much longer. But leg cramps are often an electrolyte imbalance, whether it be salt or magnesium or all those different kind of things that can get out of balance. But there's also that problem with restless legs, and that can be connected to magnesium, but they've also connected it to too much glutamate in the brain and not enough GABA. GABA is the calmer downer of the nervous system, and glutamate's the excitatory part. And what happens is CBD oil does a really great job of helping reduce glutamate and increasing GABA, so it's really good for restless legs and things like that. How much do you need to cut down if it makes you sleepy all the time? If you're having a negative impact from the CBD oil, thank you, Diane, that's a great question. If you're having problems like that, what I would typically recommend, start over. Go back to 3 to 5 drops and work your way back up, all right? And if you're sleepy all the time at 3 to 5 drops, then go to 1 drop, okay? And if that makes you sleepy, guess what? Go get some sleep, right? Because I'm going to tell you that there is something that happens when you're, and I want to try to say this the right way, when you're sick, and when I mean sick, when you're not as healthy as you can be, your body is typically running on stress chemicals. You are running on, there's all of these, and I don't even remember the scientific name of them, catecholamines or something. But there are things like cortisol and adrenaline and epinephrine, like all of these stress hormones, they are literally hurling your body through life. And you're putting caffeine in, and then these stress hormones, and this is what's driving you. And what happens is when you start taking CBD oil, it's going to help try to calm down this major stress response. But guess what? That's been what's been driving you maybe for a year. But in order for you to heal, your body has to quit running on stress hormones. Well, guess what? You quit running on stress hormones, it may be like a serious, I'm so tired. What that means is you need serious rest and sleep. So go back to the beginning, retry it, and then start back and go from there, okay? That's all I'm going to say. Just go back, start over, and try it again. If you find at 1 drop it makes you sleepy, then you need to seriously, and I'm not saying it's you, I don't know if it's for you or not, but you need to really work on getting as much rest as possible because your body has been running on stress hormones, which is dangerous long-term to your health. I hope that helped. All right, Christy, thank you. I've lost 35 pounds since adding CBD a year ago. That's awesome. Yes. I love it all, everybody. All right, guys. Anxiety and metabolism, any benefits? Well, as a matter of fact, absolutely. So, all right, so this is what I got. I just got like a couple more minutes, and then I'll go through and answer as many as I can off air. But this is what anxiety. I've done, now, what this tells me, Jennifer, I've done videos on anxiety and metabolism. I need you to go back on this page, Dr. Jim Holland CBD, or go to my YouTube channel at Dr. Jim Holland, and you can look up anxiety and you can look up metabolism. I've done both of them. I think you should check them out. However, I'm going to answer you now as well. So anxiety, well, usually the big drivers of anxiety, a lot of times they've talked about sort of some impacts on neurotransmitters. we just talked about it. Glutamate getting too high, GABA being too low, and we know that CBD oil helps improve that. GABA is the chiller outer brain chemical, so you want that. Another one is serotonin, and serotonin is improved by CBD oil. But here's one of the ways that it works, which is really, really cool. About 90% of your serotonin is made in your gut, all right? That's important. And we know that inflammation in your gut and things like that, CBD oil helps with that. So when CBD oil has a positive impact on your gut, it can actually help your gut make more serotonin, which is a feel-good chemical. So yes, it can help with anxiety and metabolism. It works as well. All right, how about the effect for, I don't know about the heartburn again. What are your thoughts on someone who has thyroid cancer and must take Synthroid daily for the rest of my life? My levels cannot be altered in any way. Word until I go back to my endocrinologist to get my levels checked. That's why I've chose to stay at a very low dose until I'm checked. I guess I don't completely understand the question. So, now this is what I would say. If you had thyroid cancer and they removed your thyroid, then you shouldn't. Then your CBD oil is not going to have any impact on your Synthroid levels, because Synthroid is a medication you're taking and not on anything being made by your thyroid gland. But I'm not 100% sure about that or about what you're asking about. So I got to kind of skip that one up. Rebecca, thank you everybody. Neuropathy, I talked about that. How about cancers? Well, I'm going to go ahead in just a second. I'm going to get off here, but I'm going to end with this one. I haven't talked a lot about cancer just because, it's a really touchy subject, and I don't want anybody to just be like, especially those of us that talk about CBD oil, all of you out there that are that are reps for CBD oil, I don't want you to run around and start telling everybody, oh, you got cancer? I got CBD oil. This is going to fix you. Please don't do that. It's embarrassing, and it's just, now, you can talk to people, you could share research, do your research, and give them information about how CBD oil can have a positive impact, but I don't talk a lot about it. But yes, there has been a lot of positive research studies. I highly recommend going on PubMed and printing them out and doing your own research about cancer, but there is a lot of good research on it, all right? I'm going to go through these now and go through all of them. Thank you guys so much for getting on. I hope you got a lot of value out of this tonight. Please like it and share it. Last week's video got almost 6,500 views in 1 week, so I want this one to get like 10,000 this week, all right? I know with all of your help we can do it. So once again, if you want the CBD oil that I recommend, direct message me and I'll tell you what you can get. If someone else sent you this video, direct message them and they can help you. If you'd like to be on my team and sell CBD oil, you direct message me, say I want to be on your team, I'll get you on my team and we'll change the world, all right? And number 3, if you want more information about my health transformation program, weight loss, diabetes, inflammation, high blood pressure, high blood sugar, whatever it is, featuring CBD oil, you click yes in the comments in Messenger. It's going to send you an opt-in. You opt in, you can check it out, all right? But I hope you got a lot of value. Like it, share it, like it, share it. And just like I tell my son every day before he goes to school, be your very best today. # never quit. And I believe that God wants the very, very best for you. And the day you believe that, it'll change your life forever. Have an awesome, awesome day.